And in health matters, and what is seen as a move to ensure sustainability in the fight against diseases in the country, Kenya now plans to graduate from its dependence on the Global Alliance for Vaccines and Immunization, Gavi, for the supply of primary vaccines by the year 2027. Health Cabinet Secretary Mutahi Kagwe says plans are underway to ensure all medical products are manufactured in the country. A statement coming at a time when Kenya continues to rely heavily on other countries such as India for vaccines. Here's Sahada Hassan with that report.
As the effects of COVID-19 continues to disrupt livelihoods, posing a threat to health systems globally, Health Cabinet Secretary Mutahi Kagwe now says lessons have been picked from the ongoing pandemic, among them the need for the country to be self-reliant on matters vaccines.
We seek to address the tax issues that have been a burden in terms of the competitiveness of our suppliers. For example, we have a tax structure where locally manufactured vaccines are disadvantaged over imported vaccines via a tax and duty regime.
Speaking in Kilifi County during his second tour of the vast coastal county, the health boss said the current deadly second wave wreaking havoc in India has interrupted the supply chain of the vital commodities, with interruption now calling for the need for a sustainable approach in fighting diseases. Statistics by the government indicates that Kenya imports 70% of its pharmaceutical products, with countries like India being the country's top import destination. According to KEMRI's Deputy Director Dr. Matilo Mwao, who is also an infectious disease expert, the new COVID variant in India seems to be lethal.
We think that because it is much less susceptible to neutralization by antibodies, it may be less susceptible to the main vaccine India has, which is the AstraZeneca vaccine. Oxford AstraZeneca may not be as effective. This virus is much more transmissible and appears to be much more deadly, causing hospitalization and death much more easily than the normal coronavirus.
As COVID-19 infections continue to surge globally, the World Health Organization has warned that 3 countries in Africa face high risk of COVID-19 resurgence, with only 1 country said to be at low risk of a resurgence. WHO also says recent political rallies in countries such as Benin, Cote d'Ivoire, Guinea and Kenya caused a spike in new infections. This even as the country's COVID-19 infections have been on the decline for the past 1 week compared to the last 3 weeks.
Some more 495 people have also tested positive to the disease from a sample size of 4,929. Thus, our positivity rate of about 10%. You recall that yesterday we were at about 9.8%. Today we are at 10%. It tells you that we are averaging around the same region, and our hope and prayer is that this is where we will stay.
Kagwe has warned counties that are withholding vaccines, giving hope that the second batch will arrive in time in Kenya. Sahada Hassan, KTN News.
Now, Joseph Kenywa